And as Carlton indicated, if you haven't availed yourself of breakfast, please do so. We also have additional coffee for those folks who need caffeine in the morning to get yourself going. Please know that Willie Brooks, our CEO, sends his regards. He unfortunately was called out unexpectedly and he is out of state. So he is with us in spirit and he welcomes you also to this legislative breakfast. I want to thank the legislators for attending this breakfast. We know that your time is valuable and your schedules are tight, so we certainly do appreciate your taking the time to be with us this morning. So at this time, I'd like to acknowledge the legislators and/or aides who have joined us today. And I will call your name. You can either stand up or wave to everybody. It's kind of a small venue. We have State Representative Christine Gregg. Welcome. We have Angela Powell, who's here for State Representative Tim Greimel. We also have State Representative Bradford Jacobson. Where are you? Welcome. We have State Senator Jim Marlowe. Also in the room, we have State Representative Jim Tedder. And in addition to, have I missed anybody? Sometimes people come in at the end. Okay. We have all our legislators. We also have Oakland County Commissioner Helene Zach, who's joined us this morning. Thank you so much, Helene. She's a strong supporter of the work that we do along with many other commissioners. And also in our audience today, we have former Senator Matt Dukakis. He also has been a strong and long continuing supporter of community mental health. I'd like to also thank the core provider organizations who've chosen to join us today. I know we have many CEOs and I'm not going to name everyone individually, but if you and the staff who represent your organizations who are here today would please stand so people know who you are. Hopefully you know that we have many organizations represented. Common Ground, Community Housing Network, Catholic Charities, Community Network Services, Macomb Oakland Regional Center. Have I forgotten anybody? Thank you. And then finally, certainly but not least, I'd like our Oakland County Community Mental Health Board of Directors to stand along with Oakland County Community Mental Health staff who are here. Welcome. It's been a while since we've had the opportunity to come together as a legislative group and to talk to our legislators and to really hear from each other on what's happening. This is our first legislative breakfast since 2011. I can't believe it's been that long. And so much has changed in the public mental health system since then. We have, as a CMH, succeeded in helping people achieve their life dreams through our valuable partnerships with state and local legislators, certainly our provider network organizations and other community partners. It is certainly through these relationships that we continue to achieve the high quality or excellence in services that we all believe our citizens of Oakland County deserve. October of this year began a new fiscal year in our organization where we have new budgets and new initiatives. And as many of you are aware, we faced a number of challenges over the recent years. But the fact remains that we all have a steadfast commitment to support community mental health, and we see that at both a local, state, and national level. Recently, Willie Brooks and others from this organization, board members, had the opportunity to go to Hill Day and talk to the legislators at that level, and there certainly is a commitment to mental health at a national level and a local level, and they acknowledge the importance of local community mental health organizations, both public and private. And this commitment by our state legislature is certainly evident by the overall state community mental health budget being increased by 1.5% for FY16. And we also know that because of national legislation in a number of areas, there are grant opportunities with some as high as $1.5 billion on a national level. And many of you know that Senator Stabenow helped to co-author legislation around excellence in mental health. And we just recently heard that the state of Michigan will benefit from that legislation. Allowing people to have access to quality mental health and physical health care has made a significant difference in the quality of life of people served. And it's imperative that the dollars used are used efficiently and structured to maximize direct care services. At CMH and the provider network, we continue to work to prepare for the success of this system. And as many of you know, this was the year that we celebrated 50 years in the community mental health arena, Oakland County being one of the first community mental health organizations in this state. Included in your packet, and I don't know if you've had an opportunity to look through it, you'll see various budget reduction pieces of information relative to Medicaid rebasing, increased demand for services in Oakland County, the impact of Healthy Michigan on general funds, and really more specifically today, we want to discuss Michigan's Medicaid spend-down or deductible system. For those of you who are not aware, the Medicaid deductible is the amount that an individual's monthly income exceeds the Medicaid allowance for living expense. The Medicaid services only go into effect when this amount has been met each month. We have a few statistics for you. In Oakland County, the average income level of an individual with a Medicaid deduction is $1,200 a month. And for many, their spend down, which they use for health care, is approximately $700 a month, which really leaves them only $500 a month to cover all their living expenses. I know that sounds incredible, but that's the reality as it is today. And at one point in time, Oakland County Community Mental Health received $40 million in general fund, which allowed us to use those dollars to help people meet their monthly Medicaid deductible. Today, we receive approximately $12 million in general fund from the state and have been forced to make some tough decisions surrounding service delivery, including service changes to people who have spend down. I would also like to mention that I recently had the opportunity to join a statewide committee to address this issue, and we're working on a statewide level to find solutions to the Medicaid deductible crisis. And more details about the Medicaid deductible is in your packet, so you can further educate yourself about that. As you notice, I have a few people at the front table with me. One of them is Pam Casper. Pam, do you want to give a high five, if you will, to folks? Thank you. Pam is going to talk later in this program. Pam has consented to share with us the fact that she does receive services from Community Mental Health, and she has agreed to speak to us today about what it's like living with Medicaid spend out and the dollars available to her monthly life and quality of life. At this time, however, I have the privilege of introducing you to Kathy Junker. Kathy is a manager of access and community integration at Oakland County Community Mental Health, and she really is going to talk to us about specialty mental health services that are available to the public mental health system. I know many of you are aware of that, but this is an opportunity to educate legislators and others in this room, so please bear with us. Some of this may seem elementary to you or for some redundant, but Kathy has an important message to speak nonetheless. So at this point in time, Kathy, if you would join the group and let them know about services at Community Mental Health. Thank you.
Good morning, everyone. As we know, access to mental health supports and services are important to all of us, to our families, to our communities. And for those who have a mild or moderate need in terms of mental health services, in general, people's insurance, coverage, Medicare, etc. are able to meet that need. For people who are enrolled in Medicaid and Healthy Michigan, determining who's responsible for the provision of those services depends actually on the severity of that need. For folks who are enrolled with the Medicaid health plans, there is a mental health benefit that they can access without specific referral or review required. Those Medicaid health plans do have up to 20 visits, which include psychiatry, therapy, that are available to recipients. However, folks who have a developmental disability, a more severe form of mental illness, a serious emotional disturbance, and substance use disorders would receive their specialty mental health services to be provided by the PIHP or the Prepaid Inpatient Health Plan. In Oakland County, OCCMHA is the administrator of that specialty mental health system. We are designated both as a CMHSP, the Community Mental Health Service Program, and the PIHP. For us, an eligibility screening is conducted through our centralized access function to determine the level of need and whether someone is appropriately served in the specialty mental health system. When that is determined, that individual is then referred to one of our network of providers, our core provider agencies, for those very specific specialized type of services. What is actually meant by specialty mental health? Medicaid beneficiaries with a more involved or severe situation are not likely to respond to traditional outpatient treatment, are then referred for those specialty services. The providers in that network are in a position to provide more specific, specialized, both outpatient and inpatient services, as well as provide the gateway for substance use services. In the specialty mental health system, those services are determined, coordinated, authorized through a person-centered planning process, which is particular to the public mental health system. For adults, that is a person-centered plan. For families and children, that also includes family-centered planning. Some of the services that people receive do appear similar to those that are available through private insurance. So things like psychiatric appointments, medication reviews, some forms of therapy. However, in the CMH or public mental health system, it is the intensity of those services, the frequency of those services that are quite different. There are also a list of services that are only available in that specialty mental health system. So services such as targeted case management, so that an individual has supports in coordinating, linking, referring for a network of supports. Services such as assertive community treatment teams, those very specialized, intensive, community-based services that are really targeted at supporting people in the community and preventing inpatient hospitalizations. Community living supports and respite that support folks in their natural settings, in their homes, support family to continue to be able to have their family member with them, or for individuals to live independently. Peer-delivered services, clubhouse, supported employment, all of these services are very specific to the public mental health system. We also have the capacity to provide for those services for individuals who would not otherwise access that level of care when we have the ability to use general fund dollars. As Kathleen mentioned earlier, and I'm sure you're aware, it is that general fund reduction that is impacting our system and the individuals that have been served through it. Right now, for hundreds of people in Oakland County, I believe we're looking at right around a little more than 500 people who have Medicare, but who also have a Medicaid spend down. Those specialty mental health services are what are at risk for these individuals. We have had the opportunity to use general fund to cover the cost of those services, allow the person to meet their spend down, making them Medicaid eligible, which then opened the doorway for them to receive not only our services, but access their other health care and other supports in their life, and Pam will speak very specifically to that. So that is the planning that we are in the midst of right now. We are trying to work carefully along with our core provider agencies to provide as much of a safety net and a smooth transition, a warm transfer where possible of these individuals into community supports. So for someone who has Medicare and that spend down, that Medicaid spend down or deductible, we have been transitioning or looking at transitioning people to their Medicare eligible services in the community. But as I've said, it is those specialty services, those intensive supports that can't be replicated in the community. And that is the piece that certainly is of concern to us, to all of our providers, and of course, most importantly, to the people that we serve. As Kathleen mentioned earlier, the unique services that we've been able to provide in the past are at risk. Thankfully, we are joined today by Pam Casper, who has agreed to share her knowledge and her life experience about working with a Medicaid deductible. Pam is a public mental health service recipient and a well-respected advocate for quality services for people with disabilities in Oakland County and throughout Michigan. So please do welcome Pam Casper.
Thank you for the opportunity to share my concerns and experiences. I'm very concerned that individuals who have Medicare and Medicaid spend down, which is the monthly deductible, are at high risk for losing access to community mental health services. If in 1996, individuals who are not eligible for full Medicaid, meaning not having spend down, or having spend down rather, let me say that again. If in 1996, individuals who are not eligible for full Medicaid couldn't receive CMH services, I would be dead, literally. Excuse me. Previously, I was employed as a registered nurse, and I had health insurance through my employer. In 1996, I experienced severe bipolar depression that required outpatient treatment and several hospitalizations. It was very difficult for the psychiatrist to find a combination of medications that worked for me. Despite receiving treatment from a psychiatrist and psychotherapist in the community, my symptoms increased. My depression, anxiety, and panic attacks became so disabling that I was not able to work. Psychiatrist, excuse me. This resulted in several medical leaves of absence, and my last medical leave of absence was without pay. Eventually, I had to resign from my nursing positions because it was not known when or if I would be able to return to work. I exhausted all of my savings. I cashed in my retirement plan. It didn't take long to become financially destitute. I was on the verge of becoming homeless. My anxiety and depression spiraled, and I attempted suicide. Subsequently, I was referred to Oakland County Community Mental Health Authority. Thank you. I began receiving services at Mercy Network, which is now known as Community Network Services, in the fall of 1996. It took many years to find a combination of medications that worked for me. It was the intensive services that I received on the sort of community treatment team that really helped to stabilize me. I was seen anywhere from 3 to 5 days a week. They have 24-hour on-call availability. And it took many years for me to become stable enough to even be able to transition to less intensive case management program. The case managers had helped me apply for Social Security disability insurance, Medicaid, and food stamps. They linked me with a program that subsidizes my housing. Because of the severity of my health conditions, I was approved for Social Security disability insurance benefits. Ironically, I didn't have any health insurance, even though I was deemed that I needed Social Security disability because of my health conditions. I was told I'd be eligible for Medicare after receiving Social Security disability for 24 months. I was not eligible for Medicaid because my Social Security disability benefit amount was 113% of the federal poverty level. The income limit for Medicaid was 100% of the federal poverty level. However, I was eligible for Medicaid with a monthly deductible that was more than half of my income. I couldn't afford the physical health care that I needed because I didn't have the health insurance. When I received community mental health, luckily they were able to help me not only with my mental health services, but but also it enabled me to get the physical health care that I needed after my Medicaid spend down was met. I now receive case management, peer support, clubhouse, and psychiatry services. The services that I have been and continue to be instrumental in my recovery. Currently, my Social Security disability benefit amount is $1,129 per month. My monthly Medicaid deductible is $694. Obviously, I cannot afford to pay Medicaid deductible in order to be able to continue to receive especially mental health services that I have through Oakland County Community Mental Health Authority. Unfortunately, as Kathy told you, Medicare doesn't cover the specialty mental health services, which she would very nicely outline for us. In fact, according to the Bazelon Center for Mental Health Law, despite the rates of serious mental illness among Medicare beneficiaries, the program does not offer the full array of mental health benefits that are effective in helping people recover from serious mental illnesses. A limited mental health benefit package deprives beneficiaries of the mental health services that are most needed to improve their functional health. I am just one person, and there are so many other people, thousands of people throughout the state that have been receiving community mental health services that have helped them with their journey in recovery. Some people may not need any specialty mental health services anymore, and that's good. However, there are individuals who will still need, and people in the future who will need specialty mental health services. And unfortunately, because of the general fund cuts, this could become a dire situation for individuals. And I would appreciate any assistance that can be given And whether it's reforming the Medicaid deductible system or to increase the general fund so that individuals who need to receive specialty mental health services can get the services that they need and help lead to a productive life. Thank you.
Thanks, Pam. And I think it's also important for people to know that Pam has for a long time been a strong advocate for community mental health services, and even in spite of the fact that she often says, gee, I'm so nervous when I do this, she pushes through that wall continually to tell her story because she so strongly believes that she needs to speak on behalf not only of herself, but everyone else represented who has a similar situation. So you may have seen her in Lansing. She has certainly done that several times in the past, and no doubt she will continue to do that in the future. So thank you once again, Pam. There are so many different things we can talk about relative to the state of local community mental health. We've chosen to focus on Medicaid spend down or deductibles because it certainly is a dire situation for us. And I think it's also important for you to know that it's not only a situation in Oakland County, it is occurring across the state, and there are many community mental health organizations that are facing the same kinds of decisions that we're facing relative to the reduction in general funds and the, if you will, hole in services that it's creating. I believe when the funding was shifted from general funds to cover Healthy Michigan, the intent certainly was very good, and we've seen so many people enroll in Healthy Michigan. However, the shift in dollars did create this current situation, and as you heard from Kathy, we're trying to do many things we can with our community partners to piece this together, including shifting from a general fund revenue stream to substance use revenue stream, and certainly we become fine managers of revenue stream funding with its revenues and expenditures, but we can only do so much with that. So we felt this situation was so important that we needed to focus on this specifically today. So it is our responsibility for each and every individual that we serve, and certainly as a community mental health system, to bring this issue forward. So at this time, I believe we're through with our presentations and we're ready to open up for any questions and answers that you might have. Oh, before I forget, however, we do have a few state representatives who have joined us, or at least two. Please welcome State Representative Tim Gremmel. Thank you for joining us. And State Representative Clint Kesto. We appreciate you joining us. And I hope that you arrived, I maybe didn't pay attention, but I hope that you arrived long enough to hear Pam's story and the importance of it, because quite frankly, even though Kathy and I presented first, I believe we really do come last. And so I like to say we present with Pam rather than Pam presenting with us, because that's as it should be. So I believe I've introduced all the legislators now. One more? Who's come in? Who do we have? Welcome.
Oh,
I have the card.
Senator Marty Nolenberg's office. Thank you for having me.
Thank you for introducing yourself. We appreciate it. Welcome once again. At this point in time, we'll entertain any questions, and hopefully we have some answers for you. Yes.
I have a question pertaining to our district, which is the city of Pontiac. I've had calls from two constituents who this Medicaid spend down, this Medicaid spend down is also affecting families who have children. And a couple of the households, same amount of income that Ms. Pam has. And that deductible is very high for them to meet on a monthly basis. That's the key. They have to meet this every month. That, for a person that's probably in that income bracket, that is very, very difficult for them. So my question is, did this change, it just happened this year? Because a lot of families are being impacted by this, and also it has forced families not to even be able to take their kids to the doctors. Because just so you know as well, some doctors are not accepting them because they say when they bill for Medicaid, it takes so long for them to get paid. So now parents are like panicking because they can't take their kids to the doctor as well. So I just wanted to put that on the radar of our senator offices and our representatives to know that that's an issue, because now our kids are not getting their health treatments that they need. Now, if it's another avenue that you can tell me, or a referral, I can probably shift these families to get some type of assistance, but as of right now, if they can't meet that medical spend down amount, they can't go to the doctor or get the specialty, services that they need.
Right, this is an issue for everyone receiving services through our system, our public mental health system. And the reality is, if they can't meet the spend down to get public mental health services, they also still have a spend down or deductible for physical health services. So the stories that we hear from people are, gee, not only will I not be able to get the services that you provide, but I don't have the out-of-pocket money to go to the doctor to continue to get my health care. There are places where people can go. We know that we have federally qualified health centers that are responsible for supporting people who have no insurance. Hopefully there's fewer people, or have a hole in their insurance. But this is a problem on a large scale for many people, not only adults receiving services, but also for families where kids are receiving services. So I don't have any fast answer for you today. That's why we're here today to talk about this. I can tell you from my work with the statewide committee, folks have gone to the Department of Health and Human Services to ask what kind of dollars it would take to address this issue. I don't have those numbers yet, and I'm not sure if the statewide committee has gotten that yet from the department. We know that it's very difficult to go to the legislature and say, gee, we would like dollars. There's a lot of competing issues, and we recognize that. My suggestion to the statewide group is, yes, if people don't get these services, they will likely end up in emergency departments. They could end up hospitalized both physically as well as psychiatrically, and that cost comes then on the back end. So one of the things we need to do to show the legislature is, what are those costs that if people show up at the emergency departments or emergency rooms, what cost is attached to that? What cost is attached to hospitalization? And then compare those costs in terms of what additional dollars it might take, because we will have to pay for that either on the front end or the back end. Any other questions? Yes, Representative.
Thank you. Why don't you spend a few minutes talking about what your experiences have been so far with the merger of DHS and DCH? Any feedback you want to give us as legislators with the merger?
Okay, for those folks who didn't hear, the question was our feedback on any merger of the departments into the large Department of Health and Human Services. I do know that we have certainly seen the Mr. Lyons' strategic plan for FY15. I'm not certain I've seen FY16 yet. And I have to say, boots on the ground in Oakland County, I'm not certain that has shifted to this locale yet. We are having on our own great conversations with our partners at the local level. Susan Hull from the ex-Department of Human Services, now Children's and Family Division. Certainly we continue to have ongoing discussions with the Health Division from the county, and they are recipients of department funding also. So although the charge has been to bring things together, we haven't really quite availed ourselves of what that might be. Quite frankly, I have to say, the conversations that I've had with people at the state level, and I've been around long enough to know a few of them, is that they are certainly interested in hearing from us on the grassroots level. So we really believe our responsibility also starts here. We just don't wait for it to be pressed down to